Hello, everyone, and welcome to our 2025 PKD Summit. My name is Michelle Goodfellow, and I'm the Communications and Engagement Manager for the PKD Foundation of Canada, which is the only national organization solely dedicated to fighting PKD through research, advocacy and awareness, and education and support. This session is a roundtable discussion by team members from the Transplant Wellness Program, which is a fascinating research study being conducted at the University of Calgary. We'll have live question and answer period throughout the call, so feel free to put any questions in the Q&A area or also in the chat is fine, and we'll try and address all of them as we go. This session is being recorded and will be available to view on our YouTube channel in the coming weeks. So I'll now introduce our panelists. First, we have Kathryn Wytsma-Fisher. She's a clinical exercise physiologist, kinesiologist, and the research program lead for the Transplant Wellness Program at the University of Calgary. Her research interests are all around the benefits and impact of exercise on chronic disease patients. She enjoys spending her spare time with her husband, son, and 2 dogs, as well as being active outdoors, hiking and camping. We also have Katie Bakgaard. She's the kinesiologist certified exercise physiologist for the Transplant Wellness Program. She brings extensive experience supporting patients through complex cardiac conditions, combining clinical expertise with compassionate care. And then finally on this call, we have a patient partner. Kim Holowatiuk is an AD-PKD patient living in Alberta. She is currently waiting for a kidney transplant, and she's navigating life with stage 5 PKD. Kim shared her Voices of PKD story with us in 2024, and this past summer, she gave us an update on about her participation in this Transplant Wellness Program. So those are available to read at any time if you want to on our blog. Kim was encouraged by the support and community that she found within this program. So welcome all of you, Kathryn, Katie, and Kim.
Thank you.
Thank you.
Just wanted to let people know this is going to be a roundtable discussion, so it's going to be a little bit more informal, and we're just going to talk about what the Transplant Wellness Program is and how it was put together. And so why don't either Kathryn or Katie, do you want to share how did the Transplant Wellness Program come to be, and what was some of the research that informed the choices when setting up this program?
Katie, go ahead if you want to start.
Yeah, so I wrote out a few things. So the Transplant Wellness Program is a comprehensive support program for organ recipients to establish and improve wellness behaviors before and after transplant surgery. Its core focus is on exercise and behavior change support, helping patients build sustainable, healthy habits. The Transplant Wellness Program was created in response to the evidence that being more physically active before transplant prehabilitation and after transplant rehabilitation is beneficial. The results include better surgical tolerance, shorter hospital stays, faster recovery, and better physical and mental health. The program is a clinical intervention and a study of how to implement and sustain such a wellness program in real-world transplant care. It is intended to be an ongoing support for patients pre and post-transplant, specifically helping patients become more physically active.
And how were patients, what kinds of patients are enrolled in the program?
Yeah, so the patients that are enrolled in the program are kidney, liver, and lung patients. And they are approached by their transplant team if they feel that they're eligible to undertake an exercise program that's safe for their health and able to do that. So we're really lucky to have a great referral network from the staff in the transplant program at the Foothills Hospital to be able to help us with that. And Katie, did you have any other comments? No, okay.
Kim, what made you say yes to this? How did you learn about it, and sort of what were you feeling when you decided you wanted to say yes?
I learned it through my transplant team. And I said yes because I had noticed a huge shift in my physical capabilities. Just with the regular things that come along with PKD, with the anemia, fatigue, and muscle atrophy. And so this seemed like a good opportunity to try to get a little bit more movement into my life in a safe environment with people who were really well educated, Katie, on how to approach this particular um, subset of people who are pre and post transplant. So the safety aspect, and then the aspect of actually trying to have a little more gain in my health and movement pre transplant, and then post transplant as well.
Awesome. And for those who may not have read your story already, can you share a little bit about where you are right now and kind of how you're feeling health-wise and how you're feeling mentally?
Well, I'm stage 5. My GFR is at 11%. And I also have polycystic liver disease. So I have quite the abdomen full of stuff. Uh, and just it's been quite a journey. I'm sure many people with PKD have gone through things with the dealing with the fatigue and the inability to do things that you used to do before. Carrying around the extra weight of the kidneys and the liver is pretty difficult on my joints. So I've had to adapt to that, which the program is really great in helping you do, seated exercises, giving you different options so that you're able to move to where your body is comfortable, not just, I guess saying like even just that day, like how comfortable you're feeling, because of course from day to day you may be feeling better or worse. I've been dealing with a lot of cyst ruptures, so that's been fairly difficult, especially because with pain management, it's quite limited with stage 5. And with mental health, I'm trying to take advantage of as many programs as possible, from doing mindness classes, and then of course a lot of mental health is starting to be incorporated into this program as well, which has been really helpful, and just the benefits of physical exercise on your mental health as well.
I see there's a comment from another patient in the comments who's saying, I understand you and sending you so much positive vibes. I happen to know that she's had a double transplant a year ago. So,
Oh, wow.
yeah. Did you have any nervousness at all before you started? What were so many worries you had, or were you just wanting
Absolutely.
to jump right in? Yeah. Okay.
Yeah. When I was healthy, I was more of an athlete. So I played a lot of sports and I did a lot of running, and it was very hard to deal with, I think, mentally, knowing how far my physical well-being has been kind of going down the drain. So I was very nervous about would I be able to do the exercises, how would my body react, especially with my joints. And then just, I think too, part of my issue with having the big PKD belly is I'm very self-conscious about what I look like. So that was kind of, even though it's done during Zoom, you can see participants, and it's, I think that's just my own issue with my self-esteem and how this disease has really changed how I looked. So I was very nervous on several levels. And after doing the first intake in the first class, those all melted away really quickly. This team is so supportive, so caring, and so accommodating. It's just a really, really great community.
Awesome. Well, let's move on and talk a little bit about some of the strategies that were put in place for the program. So either Kathryn or Kathryn or Katie, what strategies did the team use to help people feel engaged in the program, maybe to overcome some barriers, like Kim mentioned, some fears that they might have?
Okay, yes, I can answer that one. So the Transplant Wellness Program, it does include one-on-one wellness behavior change support at least twice throughout the program. And this is a chance for patients to connect with an exercise physiologist and discuss specifically the lifestyle behavior of movement. We know that physical activity is a modifiable risk factor for disease. However, most people need support around how to add in more physical activity or how to address barriers around physical activity. Ultimately, our goal is to support patients in living well and provide strategies for how to increase physical activity throughout the week. Additionally, we offer group wellness sessions as a monthly webinar. So these webinars have included topics such as goal setting, stress management, self-compassion, and self-monitoring. So these topics are actually introduced in a wellness manual that we created for the patients. So everyone gets a wellness manual at the beginning of the program, and the webinars just present an opportunity to dive into the topics a bit further. We've recently also introduced dietitians to the list of people presenting at these monthly webinars, and fortunately we've had really great attendance for the nutrition webinars, so we'll continue to offer this service. Again, the whole goal is to support patients in living well. So if your barrier to living well is specific to nutrition or stress management, we want to support you in that and provide resources to help you improve that aspect of your life. I've talked a lot about what we offer as a program, but I can talk about a specific common barrier to increasing physical activity that we see a lot in the one-on-one sessions, and that is the barrier around their confidence. So similar to what Kim had mentioned, but confidence is really not your motivation for change. It's the belief that you can exercise safely, successfully, and consistently. So how can we support someone lacking confidence in movement? Well, first we educate, we start with education and reassurance. So light to moderate intensities of exercise are safe pre and post transplant, and they have many health benefits, as mentioned earlier. Second, we engage the patient in these one-on-one exercise sessions. So that would be separate to the one-on-one wellness session. So the one-on-one exercise session is where we're just teaching the movements before bringing them into the class. Okay, so the patients are allotted up to 4 individual sessions with an exercise physiologist before starting the group classes. And it just gives them some time to comprehend the movements. So that's a great first step to building confidence with movement. Third, we help to encourage each patient to set realistic goals. For some, that is just 1 class a week with us, and for others, it looks like adding in more movement each day. We know that goals can help to build confidence and support long-term exercise adherence. Fourth, we normalize physical activity through peer reinforcement and community. So when it is a patient's first class, I give them the opportunity to introduce themselves, and I often ask other patients to give the new patient a word of encouragement about the classes and this lifestyle change. I've heard patients say things like, "It will be worth it. You will feel so much better within a few weeks." And this encouragement from other patients is truly more helpful than anything I could say as their instructor. Lastly, in class, we present the opportunity for patients to leave after 20 to 30 minutes if they are deconditioned and cannot make it through the entire 60-minute class. We only use empowering language in our classes, and every movement is completed at a pace that feels comfortable for each patient. So that's a little bit about addressing the barrier for confidence through one-on-one support and in the class settings.
Thank you so much. Kathryn, is there anything that you wanted to add to that particular topic about, how the team had set up the different components for patients?
Yeah, I think the big thing is when this program first started, it was really recognizing that making a change and a lifestyle change, such as incorporating physical activity, wasn't going to happen without behavior change and wellness support. Like, they go hand in hand with each other. So it was really important to the team that we established a multidisciplinary approach to servicing our patients and making sure that they had access to as many resources as possible from a lot of different areas. It was more important to make sure that we could provide ongoing support. And as we've developed this program over the years, we've been able to just build on that even more so than where we first started. So as Katie mentioned, we brought on the dietitians, we have different wellness behavior change support webinars, and we're always looking for feedback from patients to hear what they really need. And Katie did such a great job of highlighting how she and the other exercise physiologists are able to support the patients both in class and out of class. So I really just want to highlight the vast kind of multidisciplinary approach that we've taken kind of from day one, and how we continue to update this as we go based on the feedback that we get from participants, because that's the most important thing. This program is for them, and we want to make sure that we are helping with where they need the help.
Thanks so much. Kim, take me back to your very first session. It was a Zoom call. Kind of what happened during that session, to sort of turn around or make you feel a little bit more confident, or that, this was the place for you?
I think just the emphasis that things are done at your pace, that you're in control. So it's not like a regular exercise class you'd go to at the gym where the instructor's at the front trying to get you to push you further and further. Like Katie is so cognizant of watching everyone and seeing if someone's struggling, and almost in a sense giving them permission to take a break, slow down, grab a sip of water, whatever you need to do. So you really feel engaged in the class, where you feel really safe, and you feel seen as well. I don't know how she does that, watching so many people at once. And I know she has a helper that does the music as well and countdowns. But it just made me feel very comfortable, and it made me feel very safe. And I think that was the most important thing, is that I felt that I could do this safely. And there were someone that was actually really paying attention to seeing if I'm struggling, and almost giving you that permission to be able to kind of slow down, which, I don't know, for me, it was very beneficial, just to be able to kind of have that permission. And like I was saying before, it's on a day-to-day basis. Some days you can go in and you're like, I could do all these exercise standing. And then the next time I'm maybe really fatigued, and I'm like, I can maybe do half and half. And I can't emphasize enough how well supported you are by the team, just to make you feel comfortable and make you feel like you really are accomplishing something, which you are.
Awesome. Were there other ways that you felt really supported by the group? I know that in your update to your Voices of PKD story this summer, you talked about just the community aspect of it. What was your experience with that?
It's almost like, well, you get to know the participants a bit as well, because you see them so often, and you get a little insight into their life as well, if they're willing to kind of share what's going on. I can't emphasize, like Katie and Jenna, just how in tune they are with each participant, the follow-up emails, the follow-up calls. They'll stay online after the class if you need help with something, or if you have questions. They're just incredibly accepting and helpful, and of course very knowledgeable. And so just the comfort level. And we did a little luncheon at one point at the U of C, which was amazing, to meet everybody in person and kind of build a little bit more of that camaraderie. I'm not able to participate in the in-person events that they've started, just because it's about an hour and a half drive for me. But those look like so much fun, where, they're going for a walk outside or going for a mall walk, and just being able to socialize with people who can really relate to what you're going through and how you're feeling. And just, that's very validating as well.
So I know I've seen a question come in the Q&A. Someone's asking, are there any classes available for children or youth that are affected by PKD? or family groups where parent and child, both with PKD, could go together with other families. And I don't know if either of you will be able to answer that, Katie and Kathryn, but in your own experience, how would a family find a group that they could participate in?
Yeah, unfortunately ours is not. It's 18 plus for ours. Which is unfortunate to hear that. I actually am not sure how to find one for children. Kath, do you know how? Or
Yeah, I'm not sure either about finding it. I mean, we can speak generally to just, trying to be active as a family as much as possible and really trying to find different ways, like going for walks after dinner or playing together in an active way kind of throughout the day as general recommendations. But I haven't heard of any sort of pediatric specific programs that are out there either. And Katie, you mentioned the same thing. So
yeah, I'm
And I
sorry.
think perhaps one of the challenges with if someone's looking for sessions for children with PKD is that it's not families don't often know that a child already has it and usually don't approach testing until much later unless they're experiencing some symptoms and need some intervention. So it might be very rare to have, a PKD specific family group like that. But certainly if anyone was interested who wasn't living in Southern Alberta, but were looking for some help trying to do some of this on their own, what would you suggest in terms of how they would reach out and find people like you who do exercise physiology?
That's a great question. Katie, do you have any? I didn't mean to interrupt. Did you have any thoughts off the get-go?
No, I was hoping you'd have an answer.
Yeah. I think if you're looking for like exercise physiologists specifically to support either the Alberta Kinesiology Association or the Canadian Society of Exercise Physiology has resources and list of staff that are available in different parts of the country that might be available to be able to connect and answer those types of questions. I mean, we're always able to provide general ideas and general guidelines and help. So if you had questions, you could definitely reach out to our program and we could maybe provide something from at least a stepping stone to be able to get going. It's hard because although the exercise world is big, it's also very small. So we often know who's where and who's doing what kind of across the country, but I haven't heard of anybody specifically from a kidney standpoint, but the kidney world is quite small. And if we were to reach out to even us, then they would be able to maybe connect you with someone in your area.
And I can tell the viewer who was asking that question, if they weren't attending our previous session, 12 today, it was specifically just on exercise and PKD at all stages. And there were some good suggestions for trying to connect with either an exercise physiologist for one-on-one work or finding programs in your areas. So we'll have that. Once we put the videos online, we'll have that for people to be able to refer to as well. But thanks for trying to answer that question on the spot. To go back to the Transplant Wellness Program, though, do either Katie or Kathryn, do you have any advice for people who may be approaching transplant based on what you've been experiencing in this program? And feel free, if you don't think you want to give advice in this way, that's okay too.
Yeah, Katie, why don't you tackle that one?
Sure, yeah, our advice is pretty simple. It's just to start preparing early to engage in physical activity, connect with a nutritionist, and work on those general lifestyle habits while still on the wait list. so that you're stronger going into surgery. For this, you got to work closely with your transplant team to understand your timeline, restrictions, understand your immunosuppression, medication regimes, how they affect nutrition, bone health, blood pressure, glucose. There's a lot of information to learn and absorb. Engaging in psychosocial supports, so counseling or peer groups early is beneficial because the transplant journey is long and emotionally taxing. For exercise, just focus on consistency. Small daily or weekly habits often matter more than the really big efforts. And just be patient and gradual. So try not to overdo it. Allow time for rest and recovery and listen to your body. Now we know these are learned skills. It takes time to integrate physical activity consistently and listen to your body in the process. So a program like the Transplant Wellness Program is a great way to have some consistent support in that transition.
And Kim, how do you, when you look at where you were when you first started with the Transplant Wellness Program and where you are now, either in terms of how you're feeling physically, how you're feeling mentally, what for you have been some of the best benefits of participating in the Transplant Wellness Program?
Well, definitely the confidence that Katie had talked about. When I came to my 12-week date in the program, Katie offered me a whole bunch of different things to look at that I could incorporate outside the program as well for movement, with things that were interesting to me. Like I liked doing dance. And so she provided me with some information on some different apps and stuff that I could use outside the allotted time classes to keep me moving, the goal setting. I noticed, I think the one biggest thing that I noticed was my balance. My balance was horrible before, and they do a lot of balance exercises, and just to see that improvement was just so encouraging for me. Just something small like that. And then when we did our testing, to see my improvement there as well, like how many sit to stands I could do, how my balance had improved. So that was all just really encouraging because, you get into the program and it's just, it's really gratifying to see that, yeah, you actually are making progress. And then just seeing little things in my day-to-day activity, that I was like, hey, this is a lot easier to do than it was before. So, and then again, that confidence to kind of do things on my own as well has been really important.
If one of the people who were watching this session or someone else in the PKD community was maybe a few steps behind you in their own journey with PKD as they head towards transplant, what are some things that you would say to them to encourage them about some of the benefits that you've seen? What would you say to others?
Well, I think I've always kind of said this about the program is if you have the opportunity, go for it. You've got absolutely nothing to lose and everything to gain. Again, it's a real, it's kind of a tight-knit community that's super supportive. I think the earlier that you can start, the better off that you'll be. I wish I had started doing this a little bit earlier, in hindsight. And if you're not able to do the Transplant Wellness Program, then, try to seek out some kind of consultation from someone who is educated and knows what they're doing, with pertaining to people who have kidney disease, and just start moving, even something simple like just walking, and trying to incorporate it, like Katie had mentioned, trying to incorporate that into your schedule so that it eventually becomes a habit. So that would be my advice is it's so beneficial. And I really think that you should, if you have an opportunity, just dive in.
If you could give some advice to your younger self, you talked about you wished you could have started something like this earlier, because we often get questions from people who are newly diagnosed, but they're fairly earlier in their journey, maybe stage 2 or 3 kidney disease. If you could go back and look at your own self and do or say something that would just help her, what would you say?
I would probably say get engaged with the community. Learn about the disease, learn about what you can do to help to potentially prolong your time before you need a transplant. I wish I had some better information from my younger self with nutrition. Because I think for me, when I was younger and I didn't have any signs or symptoms, you're kind of that young attitude, oh, I'm infallible, whatever, no big deal. Don't have to worry about it till I'm older. And I think if you can start really preparing nutritionally, preparing with your physical exercise, and just making sure that you're reading valid resources on the disease and what has been proven to be able to help or to be able to help to kind of mitigate some things. I think that would probably be my biggest piece of advice, is to just be really engaged and be really aware and think of it as not something that you're going to deal with in the future, but something that you can impact now for your future.
Well, for Katie and Kathryn, is there anything about the program that you haven't already shared that you would love for our community to know about, even if they can't participate in the actual program that you're doing? But is there anything we haven't covered yet that you wanted to share?
We haven't really talked about like what kind of exercises that we do in class. So Kim had mentioned that we do heavily focus on balance, but we're also working on cardio and strength throughout the class. Honestly, the only equipment we use is a chair and exercise bands. So we keep it really simple. We mail everyone their exercise bands so that everyone can participate. And we just tailor the class to each person, what they're able to do. So that's kind of like what that one-on-one session at the beginning is about, is figuring out, okay, do you need to do most of these seated or can you do some standing? And when it comes to the balance, like we just encourage everyone to stand up and at least try. And it's funny that Kim said that balance had improved the most, because this is the one I hear from most patients, that their balance has improved significantly. Like someone had just told me he bought a walker in the summer, and then I did a review with him about halfway through the program. And he says, Katie, now I can walk up the stairs not thinking about it, and I am not going to have to use my walker going forward. Like this is crazy that, just working on these things. And this person in particular, like he has a Charcot foot. And so that's a condition that affects the bone and soft tissues in the foot, and it's caused by nerve damage. And so he was very against like even trying balance exercises, but I just kept encouraging him to just try. And now here he is with these great benefits. And so, I mean, that's just one person alongside Kim, but I have a bunch of testimonials from people about these benefits, like small things that are really taken for granted, that suddenly when you're living with disease become very difficult. So one patient told me, he said after starting the classes, now he can bend over after having a shower and actually dry his legs. Just something that's so small that you would not normally think of. That's, oh wow, when you're living with this disease, your body really changes. And so anyways, that's all. I just said I can go on and on about patient testimonials, but it's just, I think that we overlook balance a lot, and I love that that's really integrated heavily into our program, because that's the foundation. If you don't have strong feet and ankles, how can you possibly proceed with any type of exercise, really? So, yeah, that's just, I'm going on and on about it.
When the program was being put together, do you know, or you can tell us from your own experience, why is balance so valuable especially to patients who are approaching transplant?
Kath, do you want to talk about putting together the program, or do you want me to answer that?
Yeah, I can talk about putting together the program. So I think the biggest piece of when we're putting together the program and trying to figure out what to incorporate was function and like day-to-day abilities. This wasn't about, you know, creating a six-pack or, you know, getting really big muscles or anything like that. It was like, how do we make day-to-day stuff easier for these participants? And as Katie mentioned, balance is just so important for just day-to-day function. We take it for granted until you don't have it. So when we're thinking about what to incorporate in the program, it was really like getting the heart and lungs strong through cardiovascular activity, getting our muscles strong through strengthening activity, and getting our function strong through balance and stability and core. So that was really our foundational ideas as to how do we incorporate all of those. And then just like, as Katie mentioned, we really tailor everything to each participant, and Katie does such an amazing job of doing that. So hats off to her for really looking at each participant as an individual and figuring out how we take more generalized programming and really tailor it to them and say, well, you could really benefit from this. How do we make that happen? So that's a really big, strong point of the program as well.
Awesome. And how did it come that you have decided to add in the elements like a nutritionist as the program's gone on? Like, what was it that showed you that there was a need for that?
I think it was. Oh, go ahead. No, sorry, Katie, please go ahead. Sorry.
Oh, I wasn't there when they developed the program, Kath was, but from what I've seen, that was always kind of a part of the plan, like to address these bigger issues. Is obviously getting physically active is like the foundation of our program, but nutrition and sleep are additional areas that we want to address. We haven't particularly dove into how to help people with their sleep yet, but it's ongoing in our research, these aspects. And we just kind of gave it a try in the summer at inviting the nutritionists, and we had really great turnout. So we just kept inviting them back.
Awesome. Kim,
But
do you
Kath might have
remember?
more information on it.
Yeah, by all means, Kathryn, if you kind of understand how that came to be.
Well, I know there's just these pillars of wellness that we were trying to incorporate, and knowing that physical activity was just one pillar in there. And if you only addressed physical activity, you're not doing justice to everything else that is incorporated in an individual's wellness. So always having the dietitians and other specialists is the goal of the Transplant Wellness Program. We'd like to see it grow and develop. And as Katie said, sleep, psychosocial support, dietetics, stress management, overall wellness. Those are all pillars that we want to incorporate into the program as it develops and moves forward. And also as we get feedback from the participants about what they're really needing from their wellness perspective, helps us to inform how we can develop and move that. And I think the nutrition piece was really just hearing from these individuals to say that this is something that's really important. We figured it was always important, but hearing back from them to say, yes, we really want this, allowed us to really put that into place.
Yeah.
And are there any other aspects of the program that we haven't talked about? I know we've talked about the strength and balance and the nutrition, but is there anything else that was either there from the beginning or has been added in that we haven't touched on yet?
Kim touched a little bit about the community, and the community building is truly at the heart of the Transplant Wellness Programs. We know that many people pre and post transplant can feel isolated and or unsure about how to even start exercise. So having a supportive community can help a patient to feel connected and empowered. So Kim had mentioned that participants are able to see one another, and many people have said to me that just seeing other people like them engaging in exercise and even thriving in exercise, it helps to build confidence and motivation, just reminding them that they're not alone in this journey. And we try to emphasize that everyone's a active contributor to their own health and well-being, and this sense of belonging can help people to take ownership of their progress and feel proud of what they're achieving individually and together. Yeah, so from a practical standpoint, we intentionally try to create opportunities for social connection. So, for example, like I had mentioned, patients first class, just having a bit of time to introduce themselves, and patients can take time at the beginning and end of class to chat with one another. And that's typically when we talk about the wellness concepts. So our classes, we try to integrate the wellness topics. So we start talking about something, and I say, okay, well, what do you guys think of this? And I just stop talking, and then eventually someone will start sharing, and that's great because people then open up and are really honest and can be really vulnerable. And we're talking about these rotating topics, so every 12 weeks we do the topic again, so people have time to really think about, oh, okay, last time we talked about goal setting, I was kind of thinking about this, but now I think I can progress more. So since the topics are ongoing, that's really nice that patients have the opportunity to just chat with one another and think about this ongoing. And then beyond the classes, we host a monthly mall walk. So for patients in Calgary, at least it gives them a chance to meet up in person and build those friendships and stay active together. So community building is, yeah, at the heart for sure.
Do you, I'm assuming or hoping, have you had patient or people participating in the study who have actually had their transplants and are continuing with it post-transplant?
Yes, yes, we have. Mhm.
And what is that like? Is there a period where they're not doing any of the program, or are they sort of always there, at least joining in to say hi if they can, or how does that work? What is it usually like for someone once they've had their transplant?
Mhm. Yeah, good question. So we not only work with kidney patients, we work with liver and lung. And so in Alberta, liver and lung go to Edmonton and they stay there for 3 months for like some post surgical rehabilitation. So I usually call them at like the 3-month mark to see if they'd like to rejoin. And then kidney, Kath, what's the timeline there post
About
kidney transplant?
6 to 8 weeks.
6 months. Okay.
Yeah, where we give them time to recover from their surgery, and then not allow them, but really reach out to see if it's appropriate for them to rejoin. And if
Yeah.
they're interested, of course, we never force anybody to
Mhm.
come back. But there's been a lot of they're very keen to come back and do that afterwards.
That's good to hear. I know we've heard a lot of personal stories of people post-transplant. It's not always a straight line to, a positive change in one's life, but it seems to me like this program like this gives them almost something to depend on or lean on afterwards, if they know that they're still having some ups and downs.
Yeah. Yeah.
Yeah,
That's where
absolutely.
it's been amazing, actually. People just coming back and being like so thrilled to share their story. And then other participants just asking questions, who are awaiting a transplant. And then often people want to connect and then just say, like, oh, well, Katie, can you give them my email so that we can talk? And this happens more often than you'd think, actually. So I've tried to connect a few patients that way of just, okay, this person's already post and this person has a lot of questions. They should talk, right? Like the doctor can't always be there to answer all the questions. So it's nice to have, at least a familiar face who's doing exercise class with you. And everyone post-transplant is more than happy to share their story and talk and answer questions. So that part is really cool. Yeah.
Awesome. I noticed actually, we've had a comment in the chat area from someone who's post-transplant, and she's saying, this is a wonderful program. She says, balance is so important because you need that to also make sure that you don't fall and then cause possible displacement on the transplant list. The bone metabolism doctor, which is part of the transplant team here, sets several of these programs up so the patient learns how to go downstairs while holding the handrail, breathing exercises, and how to keep balance. And most importantly, by accepting PKD, you also need to think positively that you will beat this. Trust the medical community and get involved in everything that is offered by your local health center. You'll be amazed how the transplant department helps you, the whole patient. I went from feeling fearful to feeling happy to going to my second home. So that's a great testimonial from someone. She is in Quebec, and obviously is not participating in your program, but it definitely highlights that for someone approaching transplant and then recovering from transplant, a lot of these issues are really vital. And I think there might have been another question before, or someone saying, so fascinating to hear others with balance issues. My GP has no clue why my balance is bad. I didn't realize PKD was part of that. I assumed balance was feet neuropathy, which I have, but I seem tippy whenever my eyes are closed or looking up. And might suggest that, it's not that necessarily PKD causes the balance, but often the deconditioning can be a real factor in balance issues. Is that fair to say?
100%.
Yeah, definitely. Yeah.
Yeah. And like they had mentioned potential like neuropathy. Well, we know that diabetes is a risk factor for kidney disease. And so we see this in a lot of patients actually. So you're certainly not alone with whether it is or is not neuropathy in your feet. Yeah.
I've also noticed me personally with the PKD belly and your weight being shifted and your gait being
Right.
altered, that's made
Yes.
a huge impact on my balance and my movement. So depending on, I guess, how the PKD is affecting you, if you have that big PKD belly, that definitely affects. So that's why these exercises with the balance has been great for me to see that, oh, I can actually impact that even though my body is doing something I don't want it to do. I can have some say in my balance.
Yes, good point.
There was a question earlier on in the chat, someone asking if they can join this program if they're in Ontario. What's the answer to that? No.
Unfortunately not. No, this is a research study and it's just Southern Alberta right now. So maybe in the future there might be program expansions, but nothing in the near future, I'm sorry.
Is the program taking new patients all the time, yeah? So if someone, say, is already connected with a transplant team, is that how they would get introduced to the program? And yeah, okay.
Yeah, like usually the nurses at the Foothills Hospital are emailing me or I'm picking up referrals, but I mean it could be anyone from Southern Alberta really who gets a hold of us. Yeah.
Is it because in our previous session that was just on exercise, there was someone in Southern Alberta. I believe she's not near transplant yet, but would someone in earlier stages of kidney disease be eligible, or does it have to be someone who is close to transplant, hopefully?
We have patients who aren't on the list yet. So
Okay.
a few people who are like just trying to get on the list.
Uh-huh.
And so sometimes people even have to lose weight just to get on the transplant list. So they're
Yeah.
coming to us saying, well, I need to lose weight. Like, where do I start? So then they start with us and, maybe they do eventually get on the list or maybe they're just still being assessed. But yeah, so we have people even not on the waiting list. Yeah.
We're getting near time, so I'll just say to all of you, I appreciate so much all of you being here, both Katie and Kathryn from the program team, and Kim, it's been wonderful to see you and hear your story. Kim, do you have any last things you want to say either about this topic or where you are in your life right now? I'm so appreciative of individual patient stories because I think people can really benefit from seeing others who are going through the same thing.
Yeah, I've had a little bit of a setback with some liver cyst ruptures, and so mobility has been very limited. But I'm hoping to get back. I've kind of turned a bit of a corner. So I'm hoping to get back into the program and moving again. So yeah, just listening to Katie and Kathryn talk, it kind of gets you fired up again of all the amazing things that this program offers. And yeah, I just thank you for the opportunity to be able to introduce this program. My hope is, and my feeling is that I think this needs to be offered at every transplant clinic in every province. I think it's just, I can't say enough good things about it. I think it's just amazing, and I think it's really needed, because I think down the road, if you look at if you're looking at it from a financial point of view, the money that it would save by having people who are more healthy going into surgery, and then more healthy post-surgery. I just think it's so valuable. And again, I can't say enough about the team, about how amazing they are.
That's so great to hear. Katie and Kathryn, anything else you wanted to say before we end today?
Just thank you for having us. It's been a real pleasure to get to talk about the program. So thank you. Katie, go ahead.
No, I was just going to say the same thing. Thank you.
Awesome. Well, we're so glad that you all were able to take the time today. And I know that we've recorded this and we'll have it available on our website after, or on our YouTube channel afterwards. But I think, as Kim has said, it's a thing that can be very inspiring to people who may see themselves in the future in the same place that Kim's at, and realize, there are some things that I can be doing that will help me continue on this journey. So everyone who is on the call, we have recorded it. We'll be sending out an email afterwards when the video is available. If you have any additional questions about either the Transplant Wellness Program or for any of the people that are on the call right now, feel free to send them to endpkd@endpkd.ca, and we'll make sure that they're followed up on. Thank you so much, everyone.
Thank you.
Thank you.
Bye-bye.